Good morning.
Morning.
I'm Dr. Ibrahim. I'm in charge of seeing you today. So, may I confirm your details today? You are Mr. Ramesh, and you are 43-year-old. You are working as a teacher.
Correct.
So, can I address you as Cikgu Ramesh?
Yeah.
So, Cikgu, where do you live, Cikgu?
I just live behind here in the condominium.
Okay. So, how did you come to the clinic?
I drove it.
Okay. So, how are you today? How's the weather today?
The weather is okay. It was raining earlier, but now it's settled down.
Okay. Are you married, Cikgu?
I'm not married.
Okay. So, do you come to the clinic alone?
Yes, I drove it.
Okay, so may I know what brings you here today, Cikgu?
Last week I went to the GP outside Clinic Satu, and it was because I was having persistent headache. So I was actually worried that I have hypertension. So when I went there, the BP was high. So the doctor actually just gave me medicine for the day, and he asked me to monitor the BP for the last 1 week. So it was high every day because I have a machine at home. And today he said because my BP is high, I'm a government servant, so he gave me a letter and asked me to follow up here.
Okay. So, do you have any letter that you brought with me?
Yeah, I just attached the letter.
Let me see, have a look. Okay, so, Cikgu, last week your blood pressure was 160/90.
Correct.
So at home is also 160/90, and then today we repeat for you is 160/90. So this is the blood pressure, the blood investigation that you took from there.
Correct.
So from here, I can see that your cholesterol, your glucose is normal value, and then your cholesterol and your kidney also in within normal range. So Cikgu, do you have, before I go any further, I would like to ask you, how's your lifestyle, Cikgu? Are you a smoker?
Yes, I smoke. I smoke about half a pack to 1 pack a day for the last 10-15 years.
Okay. So you have been smoking for the last 10 years?
Yes.
Do you have any attempt to quit smoking before this?
Tried many times, tried, stop, but never worked out. Stop for some 1-2 months, then start back, stop.
So how about your family? Do you have any family history of?
Yeah, father is hypertensive, mother hypertensive, father has heart problem, mother has diabetes.
Okay. So Cikgu, in case of your diet, you're living alone.
Yeah.
How do you normally eat, Cikgu?
I always eat out because I'm single, so I always buy food.
Okay. So Cikgu, from your blood pressure that we have measured today and compared to the last week, I conclude here that you have hypertension, Cikgu. So do you have any idea what hypertension? Hypertension actually, do you have any idea what is hypertension?
I know it's just my high blood pressure is my blood pressure is more than the normal lah.
Okay. So actually hypertension, when the value is more than 140 above and then the below is 90. So we can say that you have hypertension after a multiple readings, it's more than 140 and 90. For your case, it's actually hypertension, Cikgu.
Okay.
So and then the hypertension, there's a few stages of it. Stage 1, stage 2. Your case, you are stage 2, Cikgu, 160 and 90.
Okay.
And then provided you are a smoker, just so your risk is higher. You have hypertension and higher risk, Cikgu. So for hypertension, actually in the long term, it is not good because it can contribute to complication. So just like stroke, have you heard of stroke?
Yes.
And then heart attack.
Okay.
And then shortness of breath.
Okay.
So before we go any further, I want to ask you, do you have any problems like blurry of vision, headache, chest pain,
So
tingling
far,
sensation?
no, nothing.
Okay.
Just headache only lah.
How do you sleep at home, Cikgu? How many pillows you need? To sleep?
One pillow.
Okay. So you can sleep soundly from night to morning?
Yes.
Okay, good, Cikgu. And then because now that I've concluded you have hypertension, I think you have to start on treatment.
Okay.
So the treatment that we have for hypertension, actually there are 2 types,
Okay.
the medication and the non-medication.
Okay.
Now let me explain to you about the non-medication first.
Okay.
So the non-medication, first thing you have to do is you have to quit smoking.
Okay.
Okay, so we have a quit smoking clinic
Okay.
in our center.
Okay.
And I would suggest you to register for it.
Okay.
Okay, we have counseling session and we have medication to help you stop smoking.
Okay.
And then the second one, I would like to refer you to dietitian.
Okay.
So this dietitian will help you to establish what kind of food that is suitable for you.
Okay.
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 And then the third one, you might need to have a more active lifestyle.
Okay.
May I know? Do you have? Are you active sportsman?
No, I am very sedentary. I'm always at home.
Okay, so for us, we need to. I mean, for you, you have to do exercise
Okay.
about 150 minutes per week.
Okay.
So it's depends on you.
Okay.
Which date which is suitable for you.
Okay.
You want to do exercise like 40 minutes on Monday, 30 minutes on Tuesday,
Okay.
and then another 40 minutes on Thursday. It depends on you.
Okay.
But make sure you do some exercise.
Okay.
As for you, I think the good exercise is with the less intensity and then less impact.
Okay.
More suitable for you is like fast walking.
Okay.
So in this initial phase of period, you have to do some fast walking. Fast walking, and then cycling and do some gardening.
Okay.
Because hiking and running is quite high intensity for you.
Okay.
So it's not suitable in this initial phase.
Okay.
So you have to start doing something active. How's your screen time? Do you are you watching TV a lot?
Moderate amount, not much.
Okay, so I mean when you do active lifestyle,
Okay.
you need to reduce the screen time as well, cikgu.
Okay.
So may I know, do you have any problems like difficulty to pass motion? Okay. So actually for your for your age, we might also need to screen for cancer.
Okay.
I mean the intestine cancer.
Okay.
So this is the non-medication part.
Okay.
For the medication part, I am going to start for you medication.
Okay.
So in view of your stage 2 hypertension, and then it's a medium risk, I need to start you with two types of medication, combined medication, which is perindoprine and amlodipine.
Okay.
So the perindoprine, you will need to take at night, and then the amlodipine you take in the morning. So after I started with the medication, you need to come and check your kidney after 2 weeks.
Okay.
So after 2 weeks, you need to come and check your kidney, and then another 1 month I will arrange for another appointment.
Okay.
So when I start this medication, the side effect of perindoprine is that sometimes certain people they will have some coughing, and then for amlodipine, certain people they will develop leg swelling. If you have this kind of problem, you can come and we will change another medication for you, cikgu.
Okay.
So when you come for the next appointment, I will arrange for urine check,
Okay.
and then for your ECG to check for your heart, and then check your cholesterol as well, cikgu.
Okay.
So do you have any blood pressure machine at home?
Yes, I have.
Good. So I suggest you to take BP
Okay.
at home every morning,
Okay.
or you can do like 3 times a week.
Okay.
So the good one, after you taking medication, we want it to be less than 140, and the below one less than 90. So what I'm telling you just now, you do exercise, stop smoking, avoid alcohol, okay? Take a good diet. The dietitian that I refer you, they'll teach you how,
Okay.
and then take medication. Okay. So and then hypertension, like I told you, the complication. I mean, the complication that can come along with hypertension is like stroke or heart attack. So you will need to be careful if you have severe headache or you have a chest pain. Then you will need to come fast to the clinic or you go straight to the hospital.
Okay.
Do you have any other concern, cikgu?
Just that this medication won't spoil my kidneys, right?
That's why we are after 2 weeks I've started the medication. I'm going to check your blood pressure to see your kidney function.
Okay.
Okay. So as for now, that is my plan for you.
Okay.
So that, do you have any other question?
No.
Okay. So cikgu, what you need to do now is you go outside to my assistant and she will give you a date for the next appointment.